I would like to welcome you all today for joining us. I am Marwa Tahir, the Executive Director of the Swiss Egyptian Business Association. I have the honor of welcoming His Excellency Ambassador Paul Garnier, Ambassador of Switzerland to Egypt. I would like also to welcome our speakers, Mr. Mahmoud Bazan, Cluster Manager Bureau, Middle East, Africa and Turkey, Chairman of the Swiss Egyptian Business Association, and Board Member of the Food Export Council. I would like to welcome Mr. Mohamed Abdelhakam, CFO-ABB, Egypt, North and Central Africa for Electrical Industries, Treasurer of the Board of Directors, SEBA. Mr. Mohamed Kassem, Chairman and CEO the World Trading Company, Member of the Board of Directors of the Federation of Egyptian Industries, Member of SEBA, and Board Member of the International Textile Manufacturers Federation, Switzerland. Dr. Mohamed Swilam, who will be joining us in a few minutes, is the Country Manager Egypt Roche, and he is a member of SEBA. I also would like to welcome Mr. Ashraf Naguib, CEO of Global Trade Matters, and he will be moderating today. Last but not least, I would like to welcome our participants, and as I can see, they are from different industries, manufacturing, construction, tourism, travel, legal firms, Swiss and Egyptian government and associations. Today, we will hear from the experts and business leaders about their challenges and opportunities when operating in a pandemic, with a focus on the sectors they represent. Mr. Bazan is representing the FMCG, Mr. Abdelhakam representing the electrical industries, Dr. Swilam representing the pharmaceutical, and Mr. Mohamed Kassem the textile, and of course he is a member of the Federation of Industry. We will continue through our upcoming webinars to assess the impact of the COVID-19 on several industries, such as manufacturing, services, travel, hospitality, technology. We will also see and assess the government measures taken to support these industries. And now, please allow me to hand over to His Excellency Ambassador Paul Garnier.
Well, thank you very much, Marwa. And as we know, you are the driving force behind the organ. Can you hear me?
Yes.
Okay. You are the driving force behind the organization of these first webinars and the ones to follow. I want to say to send my special congratulations to the new board of SEBA, the new very promising board of SEBA, of course, with Mahmoud Bazan as the new chairman, and with Mohamed Elhout as the vice chairman. He wanted to join us, but he couldn't this afternoon, unfortunately. And the other members of the board, most of them are here with us today. And it's I want to also underline the great participation of today's webinar. It's very impressive, and it's great that we can communicate through that way in these difficult times when it comes to the COVID-19 crisis. I think what should be the objectives. Yes, it's okay. It's okay, Marwa.
Yes. Yes.
Ah, okay. I'm looking. Okay. So, what are the objectives of this seminar? Well, we are seeing a dramatic spread of the COVID-19, and that it is indeed disrupting our lives, our livelihoods, and communities and business worldwide. It is affecting Egypt as well, and in these days even more, which of course is a big challenge for all of us. And I guess we have to come together and use also innovation in order to minimize the impact of the crisis and the disruptions that this crisis is bringing to us. So today's webinar is really about how to explore how companies and organizations are working together and coping with this pandemic, how they are affected by the coronavirus, and how they react quickly. They did react quickly and adapt to the effects of this serious financial investment, IT, and other areas affected by this pandemic. We know there are also opportunities for several companies, and it will be interesting to listen to hear about that. We have to interpret, the developments, and we are challenged as leaders to interpret these developments, to regain the control of the situation, and to make difficult decisions and guide our staff, our employees, as they respond to the rapidly moving pandemic. And of course, the next phase of returning to work is going to be a challenge as well, with many uncertainties. And to help business cope with these effects of the coronavirus, we really want to exchange very concretely about what we do with the large corporate executives, and of course representatives of SMEs as well, who are very important in this field, also with innovation and flexibility. And again I welcome all of you. Now I still want to take some time, if our dear moderator Ashraf Naguib allows me, I want to take some time just to give you some ideas about how Switzerland has in some ways reacted to the crisis. And the first measure was, of course, to give some flexibility for the companies to have some partial unemployment, and part of it is paid by the state. And the second big thing that was decided was to support the SMEs and to give them the opportunity to go through this crisis. At the same time, I want to highlight some of the achievements, or where we can be proud of Switzerland and its economy when it comes to innovation and to respond to the crisis. And for example, Switzerland takes the 4th place on Startup Blink's global coronavirus innovation map, which includes hundreds of solutions from all parts of the world, helping people to deal with the COVID-19. And Switzerland is already developing, and its startups are developing innovative products and services. And we have invented new technology in the areas of data management, robots, virtual medical practices, symptom checking via smartphones, or new types of facial protections, artificial intelligence-based solutions. You have leaders in the textile innovation that make now very resistant masks, and all of this is happening. And of course, we shouldn't forget, and I see Mr. Swilam in front of me, we shouldn't forget the big pharmaceuticals and that they are at the forefront of research into COVID-19 vaccines, antibody tests, and medicines that are developed. So even in times of crisis, I think Swiss companies maintain this reputation of being very competitive and driving innovation. We had to learn, as I said before, to work with tools of home working, remote working, and online collaboration, and this was done, of course, at the embassy with good results. I think we have staff, including, of course, national, international, and local staff working from home, and we had prepared a bit, actually, without knowing that this crisis would come for this possibility. And we can keep the operations of the embassy going on in the fields where where there is something going on. So we are also, of course, from the embassy monitoring the economic impact of the crisis, and we were very happy to receive a lot of feedbacks from Swiss companies about how they cope with the situation, what are the possible problems, and how do they see the future. And once again, I want to say that we are very glad that SEBA, the Swiss Egyptian Business Association, is taking a leading role in this moment. It's also taking a leading role in highlighting the CSR efforts of all your companies, and this we want to take it up as well, Switzerland, and we want to highlight it when the information will be all put together with SEBA, so that we can show also the contribution, the direct contribution in social responsibility of the Swiss company, and there are many. Well, just as a final word for this introduction, I want to say that we are in the follow-up from the embassy perspective. We are in the follow-up of the very successful visit of the Minister of Economy, Guy Parmelin, and his delegation in the month of February, just before the crisis became more acute in the Western world and in North Africa. And we want to, we are thinking to, even though it was disrupted a bit by this crisis, to really try to get the dividends of this visit with all of you, with SEBA, with all the companies, in increasing and boosting the importance of Swiss companies here and boosting the trade between Egypt and Switzerland. So I will at this stage finish my introduction, but I will be happy to come back during the seminar and during also being if I'm asked questions, be very happy to answer to them. And thank you again for every one of you today.
Thank you, Your Excellency.
Back to you.
And thank you, Marwa, for hosting this this wonderful discussion that we're about to have, and at a very timely time. And it's very imperative and important that we as the business community come together and really start thinking about how we're going to, how can I say, together overcome the challenges, and at the same time together share the possible opportunities that might come out of this, how can I say, global crisis that all countries are facing and all of us are facing. I mean, who would have really imagined since the last time maybe I've met all of you at the SEBA Awards that this would eventually be the way that we are meeting as I see you in front of me. Now, we've been hearing a lot of news about the economic impact of Corona around the world, more specifically in China, more specifically in the United States. We saw what happened in Italy, we saw what happened in Spain. And a lot of countries, despite facing the same issues, have in a sense been dealing with this crisis in a different manner. We all know that Egypt is very unique in anything that we do and in any way that we deal with such circumstances. And to be honest, we can say that Egypt was already coming from a concept of recovery from that 2.4% GDP growth that we were seeing in 2012 and 13, looking towards a 2020 7.2% GDP growth. I don't think that is going to happen. And a lot of this will be an impact on the private sector. So I want to thank all of our speakers for being here today with us, because they represent a diverse number of industries that are currently being impacted in Egypt, but at the same time may have great opportunities through this crisis. So if I can start first with Mr. Mahmoud, because one of the industries, the industry you represent a lot of people, economists around the world, and seeing it on the ground, is actually being positively impacted by, or has been positively impacted in terms of sales by Corona. This is within the food industry. If we look at agricultural exports, if we look at supermarkets, really the grocery, the food supply chain has been doing well. But that being said, of course, the situation and all of the measures that are being taken are disrupting and will disrupt eventually that supply chain. That means workers in factories, that means transportation, that means logistics, that means delivery, that means a lot of things. So my first question to you, and then that will go as we go along with each industry, is number one, how has been the impact of Corona on the food industry in general, and specifically on your company? That would be the first part. And then I'd like you to share with us how you foresee that there may be opportunities, not just within your industry, but for Egypt, as we hopefully come out of this Corona crisis. Mr. Mahmoud, please.
Thank you, Ashraf. Thank you, Mr. Ambassador. Thank you, Marwa, for organizing. I think in when we look at the food sector, it would be the least impacted through the coronavirus when it comes to a negative impact. Some of the companies were able to take even a more positive approach and got better results. But at the end of the day, what we have seen, Ashraf, and this is very important, we saw people coming into buying bulk of food, but then we saw a huge slowdown because people started to, as they felt more and more safe, they started. There was a boost, a little bit of a slowdown, but at the end, definitely the food industry would be the least negatively impacted of all the industries. Of course, as a food industry, we had a lot of challenges. One important factor for the companies and what we were is being agile, being fast, to be able to cope with the situation. And I think the focus, there is a lot of opportunities that have, as also have been brought up, like basically the online development that we have seen, that has been a trend. So getting the benefit of this needed that you have to be already prepared. So when we started, I think we had two main challenges, and the two main challenges were the safety of the employees and the safety of the business. And we had to look at each one of this. And very fast, we did a crisis. We had a meeting with the crisis team, and we started to have daily calls where everyone is responsible for part of the business and updating daily on the development. So as I said, the two main priorities we had were the safety of the people, but the business continuity. And we, when it comes to safety of the people, which was number one, okay, we started to introduce work from home. But also this was done because we started to do work from home for the departments that their physical presence was not crucial. And so some companies did not have the infrastructure, this was a challenge. Then we started to have a protective measurements for our frontliners. We started to have guidelines for the work responsive plan, a lot of development that is done on a daily basis. And the second thing is the business continuity, and this is the most important, the second most important one, and it was ensuring that you have the raw material, you have the production facility, you're able to continue producing, you're able to continue sales, and this means that you have to manage your supply chain within the developments and the challenges that are happening today. So I would say that being agile and being prepared, okay, was very important to be able to manage the situation, but also focusing on what is important and trying to put in place solutions to be able to cope with the situation. This is what made us able to deliver in these times continuously our products to our consumers.
Mahmoud Bazan, thank you very much for that. I'm going to stay with you with a very quick question before I come back to you again.
Yeah.
And I because you do handle the Middle East, Africa, and Turkey as well. Very, very quickly, tell me if you have throughout the past 2 months seen a significant difference in the way how Hero has reacted to this crisis here in Egypt versus in these other regional countries that you had?
Well, I think it is very similar the way we act, but the market, since the markets are very different, also the way you set your objective. Like I said, the two things is business continuity and be a little bit different from one country to another. For example, if you have a factory like the one in Egypt with over 1,200 employees, would be very different than having a fully automated factory in Turkey with maybe 50 people producing as much capacity. So the way you handle the business, the objective is the same, but the implementation is a bit different. So I would say in Egypt, we were the most, the fastest, the most agile, okay? And we did it with speed. I mean, in 1 week, we had everything set up, from cabins that disinfect people from coming in, from organizing the cafeterias, the mosque, the places where people change their clothes, the way they stand at the line, the teams that work together to try to separate them as much as possible in case we get an infection. So I think working in an environment like Egypt gives you a lot of ability to maneuver when it comes to crisis. We are much more fast, but as also the ambassador said, I mean, you see everybody builds on his strengths. So you can see for Switzerland, they build on their innovation capabilities. They are building new technologies, new ideas. For us in Egypt, we built on what we know best, how to solve problems. How can we be fast with solving our problems, coming back on track, delivering our products in time, and further building on, you know, some of the potential, like the online, for example, the digital, like we've said.
Thank you very much, Mahmoud Bazan, Cluster General Manager, Middle East, Africa, and Turkey. I will come back to you at the very end with a more on the opportunities and another question that I want to share with everyone. But let me please move on to Mr. Mohamed Abdelhakam, who is the CFO of ABB Egypt, North and Central Africa for Electric Industries. He's also the member of the Board of Directors of SEBA. He is the Treasurer. Thank you very much for being with us today. Again, I think the construction industry in general, which electricity and electrical industry is very dependent on, has also been one of those industries, at least from my opinion, that is least impacted, as we see that construction sites are still working, projects are still up and running, bridges are still being built, new capital city. I mean, the construction industry is basically, at least visually, still moving. Again, it doesn't cancel or negate the fact that it has been impacted, and maybe within the whole, I'm talking about the construction industry, which you're part of the supply chain of, is still eventually going to be impacted and needs a total revision. I had a conversation with Omar Sabur recently about how can you, because you've got to physically be there. That's not a work from home type of thing, except on the engineering and the consulting side. So what are the main challenges that ABB Egypt had faced within the past maybe 2 months? And how do you see turning those challenges to opportunities in the future?
Thank you very much, Mr. Ashraf. Thanks for Mr. Ambassador for the invitation, Mr. Mahmoud Bazan. I can summarize the challenges that we have seen during the last 2 months, because we have seen a lot of challenges, actually. If we look to the market, despite, yes, we can see some projects are running, and we see still, you know, some sites are working. But if you go deep in details, you'll find in every step, you can see a lot of challenges. So making our employees safe first, making our customers safe, making our stakeholders safe, this is really a challenge. Also executing our projects, delivering our goods to sites, meeting with our consultant, getting the approvals, this is another challenge. If we look from helicopter view for our operation, we can see different challenges. We can see market challenge. Okay, the customer expectation as well. You know, during this crisis, customers are suffering as well. They are facing some problem when it comes to liquidity, when it comes to delivery, when it comes to execution as well. So this is one major challenge that, you know, has impacted by the COVID-19 significantly. If you look for another challenge is the financial risk, okay? Short in liquidity, payments. Most of the companies are locked down or they have certain precautions to operate. So even if you have your payment ready, you are not able to get, you need to follow certain protocol to get your money. In addition to that, as you know, the most challenge that all companies are focusing on now is the cash and cost. So for each company, for each customer, for each supplier, his top priority is to reduce cost and to maintain and retain cash, because cash for them is the, as we say, cash is king, but at this stage, it's a super king because it's a matter of survival and they are not really expecting how long it will take. It can take 3 months, 6 months. So even if he's willing to pay, he will prefer to keep the money and cash inside his organization because of the high level of uncertainties that we have. Another challenge also is the operation. You know, if you see, we have factories, we have shop floor, we have sites, we have services. So to execute, to get the material out of the custom authorities, to release the goods, and to deliver to our factories and sites, this is also another challenge. And in addition to that, we have seen also some risks that started to be, let's say, obvious now, which was not, it was under, let's say, focus, but now it's becoming like, you know, super critical now. For example, cyber attack, okay, frauds, okay. Companies and corporates need to be very alert at this stage because you are working in exceptional work environment. So you need also to put control, which is making a challenge. You need to smooth and to simplify the process on one side because you are working in exceptional work circumstances. And on the other side, you need to maintain certain controls. So you are able also to do your job in a better way. Despite all of this, I have to say that Egypt, ABB Egypt was performing well compared to other countries in the region. I have to say, yes, there is impact, but this is really not a dramatic impact till the moment. We have seen some drop down in the volume. This is true because of some delays, some freeze for some of the projects. But all in all, we can say we are able to manage, we are able to absorb this hit till end of April and May as well. The good part is that when we discuss with our steering committees at the meeting every day, making risk assessment, making follow-up for our main project, we can see that actually everybody is very positive and say, this is going to be temporary, okay, and things are going to come back to normal very soon, which is good as well. You know, when you see that the market outlook is good, this is also encouraging the organization to move forward and also to be prepared for this. So if I compare Egypt for the whole region, because we are responsible for Middle East and Africa, we can say that Egypt is one of the top performers. And this is support what Mahmoud is saying, that Egypt was one of the countries that are really reacting, despite what we can see in the media that people are not really, you know, some of them are careless and so on. But overall, when it comes to business, we can see high level of discipline when it comes to the safety of our employees, when it comes to operation. I have to say Egypt was really one of the top performers in the Middle East and Africa.
Thank you very, very much for that, because I was going to also ask you that comparative concept of how are we doing. Before I leave you, I'll ask you a question, not so much on the opportunities, but in your opinion, and again, this is just strictly your opinion, has the Egyptian government been handling the situation as satisfactorily, at least within your opinion?
Well, I have to say there are a lot of positive parts that has been done. And we have seen a lot of actions. That first part is the communication. You know, I'm receiving calls from the central bank. Okay, they are following up one-to-one. This was not existing before. Today, you are receiving a call from central bank asking you how things are moving on. Do you see some challenges? So the communication and the response from the government, I have to say, was exceptional, okay? And I hope that this continue as well. They are getting connected to the companies, getting closer to them, listening to them, and they are changing a lot of things based on the feedback they are receiving. When it comes to labor and employees, they are giving a lot of attention. They are in contact with us, trying to ensure that our employees are safe and we are taking all the precautions. And I have to say, you can see that they are caring and they are really want to support. Okay. Of course, there are some other parts that, you know, it's like crisis. They cannot control, they cannot do everything. Of course, there are some gaps. One of the gaps that we have is the lockdown. And we have some delays in many areas. This is, you know, we cannot blame them for, but it's impacting our business. We are not able, we have some delays because of the lockdown, which we are expecting to see some kind of solution. How can we continue our business as well? Because we are setting our business continuity and we are moving forward. But on the other side, we are not isolated. We are also connected with all the governmental bodies as well.
Thank you very much for that. If you will allow me, I'll move on to Mr. Mohamed Kassem, who is the Chairman and CEO of the World Trading Company, a member of the Board of Directors of Federation of Egyptian Industries, and a board member of the International Textile Manufacturer Federation, ITMF in Switzerland. And of course, a very, very dear person to me and a mentor. And it's always a pleasure to have you. And it's always a pleasure for me to be moderating a session that you're on. Mohamed Kassem, now, again, your industry, I'm going to ask you on two sides, because you do represent the Federation of Industries in general. In Egyptian industries, over the past maybe actually decade, have been suffering and trying to recover and trying to really, how can I self-position themselves as the true natural role that they need to play within the global economy, given the fact of Egypt's geographic location and the competitive advantages that we have with the Suez Canal, you know, very large labor market, proximity to large markets, in addition to a wealth of free trade agreements and protocols that give us access to billions of people in consumer markets around the world. So from a recovering industry overall, how are you foreseeing the impact, or how do you see the impact of Corona on Egyptian industries in general, the textile industry specifically? And you know, once we get your insights on that, I have a couple of follow-up questions to you. Mohamed Kassem, you have the floor. I think we can't hear you. I think you're muted.
Okay.
Yeah.
Well, I thank you for the warm introduction. It's really, it's very nice of you to say that, and I'm really thrilled to hear everybody is here, and thank the Ambassador of Switzerland for hosting us today. I envy the last two speakers, my good friend Mahmoud Bazan and my friend Mohamed Abdelhakam, because they are part of an industry that was negatively impacted. Only that, but is teasing us in Ramadan and showing all the products that that they are producing at Hero behind him. So that's an invitation to suffer fasting. So I think I would like to refer to studies that have been conducted about the impact of COVID-19 on the industries and the economy of Egypt. These studies have been conducted by the Egyptian Center for Economic Studies, for which I am honored to be the Secretary General. We have, I think, published so far about 16 studies, sectoral studies. Some of them are represented here, including my own industry, textile, also pharmaceuticals and processed food, and last study was about the retail sector. But generally speaking, this studies started from the premise that the impact of the COVID-19 is not all industries anyway. So there is some industries that will benefit, some industries that will suffer and will be negatively impacted, and some that are the COVID-19 has been neutral to them. The food industry and perhaps the construction and construction-related industries are both coming from those sectors that will fare well under the COVID-19. I'm not saying that they are happy with the COVID-19, but due to the circumstances, some of it natural, like in the case of processed food, and some are due to government intervention when our government decided to support the construction sector with 10 billion Egyptian pounds for two reasons. One is the number of workers that are going to be negatively impacted if this sector stops, and also for the national projects that the government is so proud of, whether it is in the new capital or in Al Alamein. So for different reasons and different policies, companies will either benefit or be at a disadvantage. My industry at large is textile industry. Is a losing industry in this context. We have suffering from both supply shock and demand. The demand shock is really everybody is sitting home. Fashion is not a priority anymore, so it is not a big deal if you don't buy a new shirt or jeans. It is a big deal if you cannot find something to eat for dinner or for breakfast or lunch, but it's not the same for the clothing. Clothing becomes something that does not take priority on the Maslow scale of things. So we suffered that shock of the demand first. The closure of the retailers, whether it's overseas or even local here, small shops, Baba Mama shops closed down. So that's all impacted the demand side. On the supply side, there was a disruption in our supply chain. And things that are coming from India or China or anywhere else in the world are all of a sudden are not coming. We import from Switzerland a lot of chemicals and the dyeing stuff. So so that both we got between the rock and the hard place, and we're trying to keep our head above the water and trying to improvise and use our collective wisdom to do something. Obviously, a lot of us switched from producing regular garments to producing protective clothing, PPEs, for the healthcare industry, and including masks and gowns and surgical gowns and coveralls and all that. But that switch is not, first of all, it's not easy. Second, it doesn't help you with your immediate need. So you have all the things that Mohamed Abdelhakam referred to, the cash flow issues, all the sustainability requirement for any organization. We suffered from that. But we are slowly coming out of it. Many of our factories closed, some for a week, some for 2. And what I'm afraid of is not the current situation, but actually the future situation. Because what the worst impact of the COVID-19 is the slowing down of the economy of the world. If we are hit by a recession worldwide, which is probably the case, and the GDP is not growing positively, but we have seen some of the big economies now are contracting, we will suffer in the long term. Not only our industry, but all industries at large, because there will be less consumer confidence, there will be less employment, there will be less disposable cash. So all this will, I am worried about the future rather than the current situation. So we have to be a little bit more innovative, a little bit more agile, a little bit more adaptive to these situations. That's what we are trying to do for the time being, and we already producing masks. Perhaps you have read the papers the day before yesterday that there was a meeting to encourage these Egyptian factories to produce masks. We started exporting already some of this. Luckily, we had among our current customer some people who are working in the hospital wear or for nurses and doctors and this. So they have been there already, but for the normal clothing now we are switching to the protective clothing.
Thank you very much for that, Mohamed Bey. Before I move on to Dr. Swilam, and this is not very much an industry-specific question as much as a private sector-driven question. We understand that over maybe the past 6-7 years, the Egyptian government has been trying to, how can I say, enhance and grow our GDP accordingly to, you know, the context of what Egypt, I believe that there should be double-digit growth on GDP that will really impact positively the Egyptian economy. That's what we need, but that's not where we're at. Now, some economists say that we're going to retract back to the 2.3, 2.5, you know, when we come out of this corona. Not only Egypt, but the whole world is being impacted, their GDPs, as you rightfully stated. And my question here is, GDP growth that we've seen over the past maybe 3, 4, 5 years has been very much government led, in a sense, in infrastructure projects that we're talking about with new cities, loans coming in from international organizations and institutions like the World Bank and the IMF, seeking in foreign direct investment. So it's a very much, how can I say, government-led initiative on GDP growth. I doubt that they're going to be able to do that again. I mean, we can't do the same construction spree. We can't do all of that. So it has to be, in my opinion, a private sector-driven growth that's going to come. How do you see that? How do you see true participation of the private sector in pushing up and regaining these GDP growth that we were looking at?
Well, thank you for this very important question, Ashraf. And I'll be very candid with, in my opinion, I think the government failed the sector for not adopting the right policies, monetary or physical. The government had defended for too long the Egyptian pound until it was not able to, so it let it float, and then we have seen a 50% reduction in our currency. But it was not too long before the government started to protect the Egyptian pound again, and now we have seen our competitiveness erodes because of the I think the policy, the monetary policy when it comes to two very important things: the exchange rate and the interest rate. The central bank has at its disposal very, very strong weapons, but it's not used properly. And unless we use our ammunition in the right direction, then we cannot hit the target. The target is very clear. We need a very strong growth, and the growth has a very solid ground based on industry and on agriculture. This is the real economy. If you look at the resources, the sources of income for Egypt in the past many decades, it's coming either from Suez Canal, remittances from workers overseas. Those are the three, and big lately foreign exchange coming into the debt market, the bonds and securities that the government. So this is all not real economy. It's all very, very difficult to sustain. If with the COVID-19 impact on and the collapse of the oil prices all over the world, what do you expect the remittances of the Egyptians will be? It will definitely go down. With the contraction of the international trade, the Suez Canal fees will go down. With the slow GDP economy at large, you don't expect a lot of FDIs to come in. So that's all. I'm not trying to paint a grim picture, but I'm trying to paint a realistic picture to see where we have to act. On the monetary side, I think Egypt should adopt a very flexible exchange rate to let the Egyptian pound reflect its true strength. If I have 10% inflation in Egypt and 5% inflation in the EU, and yet my pound appreciates against the EU, the euro, or against the dollar, with that big of a difference in the inflation rates, then something is wrong. Interest rate, the cut of 3 points is very good, and it's a very courageous move, but it's not enough. We still have the effective interest rate still very low, very high. We have to reduce our interest rate to match everybody else around the world. Now is close to zero, and we're still charging too high for our money. On the physical side, also we have a big problem where the support for the industry in terms of the export incentives has not been paid for 3 years. How do you expect somebody like Mahmoud Bazan to do? He has in his budget, in his books, there is a lot of millions of dollars that he cannot collect. So it's not fair. Most of the exporting companies are not getting back their value-added taxes that they have paid before exporting. So I don't see neither the fiscal policies or the monetary policies are really driving the economy in the way it should be driven.
Mohamed B, thank you again for painting. It's not a grim picture; it's a realistic picture, and I think this is the reason why we have these interactions, for us to be able to brainstorm together and see what we want as the private sector to come out, and how we can support our government in dealing with this situation. But thank you very much for that concept. Let me please, with your permission, to move on to Dr. Mohamed Swilam, who's the country manager Egypt for Roche. You know, this is bad. I kept, like we say, best for last, because this is an industry that people are seeing as, like the food industry, still flourishing. You know, pre-corona, Egyptians have a lot of issues, from virus C to diabetes. So people, like, they still need to eat, still need their medicines and their cures. The other thing regarding Roche and the pharmaceutical industry in general is that it has a completely different, maybe Mahmoud Bazan, the food industry as well, because your factories are already sanitized. I mean, you have to abide by the highest standards of sanitization pre-corona, during corona, or even post-corona. So, you know, you walk into these factories and they look like laboratories in the food industry specifically. And then in the pharmaceutical industry, of course, we know that they are basically laboratories. So I'm going to ask you an industry-based question to start off with, Dr. Swilam, and that how has Roche been handling the situation since, you know, 2 months ago? What's happening operationally within Roche Egypt? You can unmute, please.
Sorry, I take some time to unmute. So thanks, Mr. Ashraf, Mr. Ambassador, for having me in that very rich discussion among the distinguished speakers. I'm very humbled by being with you here. Very happy to share some perspectives from pharma or healthcare in general in that unprecedented situation, which is COVID-19. And actually, the situation for us is also very, very challenging, and it has a unique impact on us, because the way we look at it is first, we have to put our own oxygen masks for us as an industry, as employees. But that has to be very, very quick, because we have other role. We have a responsibility to help the community, either in Egypt or globally, by providing solutions. So it's not only to protect ourselves. So we're very, very conscious about that role, and that's, I think, a pressure test for our speed, our agility, and our values, and our ability to create value to the bigger community, and to play here a helper and servant role, rather than look at it from a business perspective. So that's overall how we look at ourselves, and how can we deploy ourselves into the crisis, the global crisis. First of all, I think I'm sure that most of you know Roche. We're playing a leading position in the healthcare sector, either in two divisions, in the diagnostics decision and in the medicine decision as well. So I'm gonna touch on both of them quickly, but let me first put some highlights on how did we react first on the first mission, which is putting quickly our oxygen masks. And I think it's very similar to everybody else, that we had to first to move to capitalize on our agile model. Actually, Roche has adopted an agile model like 2 years ago. Thanks to that agile model, that made us quickly turn most of our operation into digital. We have to maintain our operation, because we have responsibility not only towards COVID-19 patients, if we're going to bring some innovation, and we already did, but also we're dealing with very, very critical other sector of patients. So we're dealing with cancer patients. They cannot miss their dose. And we are all living now how difficult you can go out and get your infusion in a hospital. So we're living in that, and we're trying to focus our efforts on how can we maintain our operation in Egypt and globally, to supply our tests, supply our medications, to continue manufacturing, and to communicate maybe directly with our physicians and our patients, to ensure that either COVID-19 patients, if they're getting some solutions, or our traditional patients like cancer, MS, very, very critical patients, they continue taking the and hopefully reach cure. So that I think happened very quickly within the pharma industry. We were the first company to apply the work from home policy or one of the first companies, even before the official announcements. So because we had to protect our people, and big part of our operation can happen from home and virtually. And again, thanks to the agile model. Parts of us is in direct contact with hospitals, either in pharma or diagnostics. We have engineers working in labs, and that's a very sensitive area. So we had to make sure that we're having the right measures to protect them and to help them to continue their operation. But in generally, that phase and that part went very well, locally and globally. So our supply of tests and medications in Egypt has been very, very stable. And globally, we did our best to match the requirements of the different countries. But when it comes to our role towards our patients, either the COVID-19 patients or our traditional patients like cancer patients and so on. COVID-19, I think, Roche being a global leader in diagnostics and medicine, we had to play a role. And the first, I think, in March, we made we made a test for detecting the virus, the COVID-19 virus, available globally and in Egypt. And so far now, we've been able to supply and to fulfill the requirements of the authorities in Egypt in a very smooth manner. Another test has been already available globally, and it's going to be available, I think, soon in Egypt. The discussions are ongoing to detect the antibodies for the virus. So first, you need to detect the virus itself. So you need to know if a patient has COVID-19 or not. That's one thing. A different question you may have: did that patient, did that person got infected, and did he develop immunity so as he can go back to work? That's a different test, and that test has been already manufactured, and it's available and approved globally now by Roche, and it's going to be, I think, soon available in Egypt. So that's on the tests and the diagnostics front. In terms of the medicine, we do not have any approved medications for COVID-19. Roche does not have any approved medications now. However, there's one of our old products has been tested and has been tried in some countries where it can help a segment of patients, the very severe patients, the patients who gets to ventilators and gets to acute pneumonia. So we have a medication that is used to treat rheumatoid arthritis. It's a completely different disease. However, it has been found that it can help those patients to get quickly out of hospital, not to get to the ventilator. So what we're trying to do now, we moved super quickly to put that into evidence-based medicine setting, to get some evidence to make that available. And we're expecting the results of that study to come up very soon, between end of June or July. Meanwhile, if any requirements for using that medication in Egypt, so far we've been able to fulfill it very smoothly. We're working closely with the Ministry of Health and the Unified Purchase as well for the country. And so far, I think I'm very proud of what we're doing, either with COVID-19 or non-COVID-19 patients, and that's a very critical one. Everybody is now looking at the COVID-19, but there's a cancer patient. Cancer is much more aggressive than COVID-19, and that's what we're taking care of. We're trying to do things differently, reaching to the Ministry of Health or different physicians that we're dealing with to reach the patients, to maybe help them to get the dose at home, because those patients are immunocompromised. They cannot get out. So we don't want to put them at risk. So overall, I think it's a very deep topic. However, again, to summarize it, we have a responsibility to play a different role here rather than the business. We have to put our oxygen mask, and we've done this so far quickly, and we're trying to expand our value to our patients, and hopefully add value and pass through that crisis smoothly.
Dr. Swilam, thank you. I will stay with you, but we're almost over time, and I do want to open the 15 minutes of questions and answers. I've already have a question here from Mr. Mahmoud Sadiq, which I will ask after I'm done with Dr. Swilam, but there's a chat box, so if anybody wants to come in that's participating to ask any of our distinguished speakers, including His Excellency, any questions, please just direct who the question's from and to who, and I will try and answer them within that time. But please let me get back to Dr. Swilam. And Dr. Bus, I'm going to, Khas, we understood what your organization is doing, and of course, as a global player, I understand your principle of doing good by doing business, and that's what you thought of first, how to play your community, global community role in this crisis. But then let me ask you a little bit more, because you are the only, how can I say, medical professional that is with us in the group, regarding the Egyptian healthcare system. Now, we've seen across the world some of the greatest, or some of the systems which are claimed to be some of the greatest in the world, in the United States and Europe. We've seen them suffer. We've seen them under pressure from this virus. Now we live in Egypt, and we totally understand that our healthcare system is one of those industries and one of those sectors that has been overdue for an overhaul for a very long time. And I believe that we've just received some kind of fund, so we can, I think, either from the IMF or the World Bank, to support the healthcare system. Why? It's not just managing the virus, but it's also managing the expectations. Why do we have all of a sudden this expectation that the Egyptian healthcare system in the COVID-19 has been absolutely amazingly efficient? You know, the Ministry of Health is doing a great job in transparency. Tests are being done. We've got the situation under control. I mean, as a private sector to private sector members, what is the realism behind this? I'm even hearing about some private hospitals closing. So there is an impact on the private sector healthcare industry in Egypt. And is it really realistic that our public healthcare system is able to take this? And as part of this whole question, just to close off, Egypt had just come out from this Virus C initiative, the presidential initiative for 100 million free from Virus C. Has that helped as well? Did that experience in terms of testing people and getting results and curing the Virus C, is it similar to what the Ministry of Health is doing? So my question is a three-part. One is the impact of, is the healthcare system really going to be able to take this? Is there an impact on the private sector healthcare system, like hospitals that are closing down? And have we learned from the experience of Virus C? But very briefly, please. I know it's a big question, but very briefly.
That's a very, very difficult question for any healthcare person to answer now, but I will try to tackle it briefly. So first, I think it's very tricky now. So the Egyptian response versus other countries' response. The impact, the pressure test for any healthcare system is very difficult. And I don't think Egypt or any similar country can take that pressure test if we get to the peak of it. It's a very difficult test. It's a capacity issue. But I think we've been lucky. We've been lucky in so many things. First of all, I do not undermine the efforts that has been done locally by the Ministry of Health and capitalizing in the previous experiences. Touching on your question, I think they're doing very good job. To be relatively based on we're working in that sector and we're working closely with the stakeholders. They are doing tremendous efforts and they are doing their best. Their best is still limited by our capacity in our hospitals. So numbers talk. We do not have the capacity of the German healthcare system or even the Italian healthcare system, which is collapsed. We do not have it. It's not only 1/10 of it. However, based on what we have, I think they're doing a great job. So that's one piece. The other piece is, yes, our experience with HCV, specifically when it comes to testing, experience and the infrastructure helped us. So we are one of the, I think we have the platforms for testing compared to the region. We are number 1 or 2 country in terms of having a platform for massive testing. So that is because of the heritage we have from the HCV. That's another piece. The other piece is what I'm saying, that we're lucky that we're delayed in terms of impact. So we're capitalizing on the learning from other companies, be it in the pre-treatment protocols. We know much more than 2 months ago now. So the results of the patients and the discharge from the hospital is faster. So the capacity of the hospital can be expanded by that time. Remote management, lots of learnings, and again, the local authorities, they're doing a good job in terms of learning from other countries now. And I think the biggest impact, and we're being very lucky because we didn't reach the peak yet. We didn't get the hit as quick as the other companies. Only God knows the reason for that. Scientists are talking about this, but I think we'll learn that backwards later on. We have something unique, be it in the immunity or something else, but I think it helped us to delay the curve and give us a chance to learn from others and manage it a bit different. I hope that answers your question a bit.
Very eloquently, Doctor. Thank you. Thank you very much. I know it was a complicated, and we need a whole session to talk about this, and hopefully we can do it in the seminars that SEBA will be doing in the future, more focused on specific sectors. Of course, I want to thank all our speakers. I want to give an opportunity for people that are with us to direct a couple of questions. First one that I have is a comment from Ms. Nagla Fathi. This is just for everyone, just saying that to mention that regards to challenges and government bodies getting approvals, licenses, shipments, or so on, please make use of GAFI, General Authority for Investment Free Zones. We are pleased to provide you with all the support, existing investors or local and foreign companies. So GAFI is still reaching out to us and supporting us. I have another question here from Mr. Mahmoud Sadiq, and he writes to us, he'd like to ask the speakers, he's not specifying which speakers, so we can share who would do this, but here we have suggestions regarding how technical education, maybe for Mr. Bazan, and in particular in agriculture and food industries, should adapt to the current conditions created by the current pandemic, as we should realistically expect it to last longer than we initially thought. Also, we should expect more pandemics to happen, so we should be more prepared for them. My question is for all types of technical education, i.e. high school, college, and university. So he's talking about technical education and what is the impact of COVID on this. So Mahmoud, would you like to take this question?
Yes, sure. I'm not an expert in technical education, but yet I would say we have the new normal. Okay, and we have to adapt to this new normal. So technical education is definitely very important for my industry and for the industry as a whole. And I think it's each industry has to start to, or each sector has to start to adopt to the new normal. We have to face the facts that our things are going to keep changing for some time, and the technical education is one of it. And we have to start, not only technical education, education in general, university education. I mean, if even you look at some of the like engineering or things that needs labs, how are they going to adapt? I think new technologies will come in. I think everybody will be pressured to come with new ideas, with new ways to make this happen. And technical education is one of them. I can't really say how are they going to do it, but I'm sure that there will be development all around the world to support this development. I mean, it's if I take this further and I look at an industry like mine. And I would say that when we are setting a new strategy, the strategy for the new normal, we are looking at two very important points. And we said, yes, continuity of business, but when we talk about continuity of business, also we have to manage the cost and we have to look at opportunities. And each industry. I look, for example, for Hero, and I say, okay, we want to manage costs, then we have to define where are we going to put our money. So we say, okay, we do business continuity, number one, branding, because it's very important at this time to continue invest in branding. Employee safety is one main aspect we spend behind, and community support. So this is where we're going to focus. This is where we're going to put our money. And where do we see the opportunities? All right, today with the new, again, the new normal, so we're talking about more affordable offerings. So you have to invest in new technologies where you're able to offer more affordable products to the people, more natural products with the health factor, and everybody now is looking at more healthy affordability, and further capitalizing on online channel, for example. So I think no matter what business you are in, whether it's education, whether it's FMCG, food, textile, you will have to adopt to the new normal. and you will have to make it happen.
Thank you. That's wonderful. Let's look at the next question that we have. And somebody's telling me here that I've got 3 multinationals on this session that have an intensive global supply chain. We did touch upon this supply chain. Mr. Mohamed Kassem did talk about some of the impacts on his industry because we know that Egypt is basically a net importer, and a lot of what goes into our manufacturing and processing is actually imported. So the question here is, what is the impact of COVID-19 on the future of your supply chains? Will your businesses be impacted with a slowdown in global trade and a reduction in your accessibility to resources within your supply chain? So maybe Dr. Swilam, if you want to take this, or Mohamed Bey, if you want to talk about the components that come within your supply chain. Mohamed Kassem, do you want to take this?
Well, thank you, Ashraf. Actually, it was me who asked the question, so I did not expect the question to be sent back to me. But I think there is a lot of talk now about reshoring versus offshoring that we have seen in the past couple of decades, and we also see a lot of people the impact of having supply chain and on security of the supply chain itself. I'm sure Swilam would admit to me that the active ingredient for pharmaceuticals are produced between 2 countries, China and India. And when something like that happens, then what the Swiss companies, the French companies, the American companies that are dependent, and even the Egyptian companies that are dependent on that kind of ingredients, what are you going to do in their production? So there is 2 factors here. One is the security of the supply chain, and the other is the shareholders' interest in seeing profits every quarter. So those 2 powers will play tug of war between the decision to make your supply chain secure and not dependent on faraway places, and continuing to show profit and a good bottom line for your shareholders. This is a question actually that has not been looked into seriously. A lot of people talk about it, that we cannot be dependent on China, we cannot be dependent on India. But the investment that's producing this in China and India is actually European and American investment. So I actually, my question was to the 3 gentlemen who are representing multinationals. How this is in the corporate headquarters. Are they thinking this way? Are they going to do something about it? Or it's just the hypes in the social media and things will go back to normal?
I can comment on that quickly from pharma perspective. I think having the most of the pharma in this industry is dependent on importing either finished products or APIs or active ingredients from either Europe or China, India, as you mentioned. And I think the quick reaction now is moving towards how can we ensure and how can we secure our raw materials for the future, for the next pressure test. And I don't want to be dependent on other countries. I think this is a very transient reaction because it cannot happen that quickly, because scaling up manufacturing for APIs or raw materials for medicine is not easy, and it will impact efficiency big time. So it's not an easy decision to make. So to move the industry of APIs from China and India and Italy somehow to spread it out across the world, this is a very difficult move. And I think every country or every company will think twice before taking that move. However, I think what I expect to happen is maybe looking at parts of the supply chain, whether you can move parts of the manufacturing to the local industry, be it 1 or 2 steps, so as you can have like a reserve stock, longer reserve stock, not the full-fledged manufacturing process. That's what I'm expecting in the pharma industry to happen.
Would ABB like to comment on that as well, please, Mohamed B? Yeah, you're still muted. There we go.
Can you hear me now?
Yes, go ahead.
Okay. I think, I think business after the COVID-19 would be different from the one before COVID-19. There are a lot of changes now. And from corporate perspective, we can see that there are some new trends now. New trend to maximize the local value, okay, because there will be more restrictions and this can happen again and again, nobody can know. And we have seen recently some trend is to maximize the local value, to increase the investment in some of the countries that has strong footprint. So they are also able to reduce the flow, or let's say the flow of goods from one place to another. But I have to say also that it's too early now to give clear direction how things is going to be done. We can see recently some new trend for it's not new actually, it's old, but it's becoming more important, like the online trading, the e-commerce. It starts to take a lot of attention now, because if you are working from home and you are not able to access your site, your office, then there is a need to invest more in the tools, in the electronic trading, in the tools that can enable you to do your business remotely. So I cannot give clear answer that the flow and the supply chain will change immediately. It will take some time, but we can see that there is some, let's say, discussion now, okay, to invest more in the local units more than before, okay? And they start to discuss now how to maximize and invest even for the local organization by adding more resources as well. So I think it will be also an opportunity for some countries like Egypt to get a benefit out of this crisis, where you are able to get more investment, get more training, development for the organization, and also get different business model where big part of the business before was relying on importing material and component from other feeder factories across the world. I think now there is some need to invest more and increase the local value add.
Thank you very much. Let me share with you another question. This is the last question that I have. And if anybody has any additional questions, please, you can send them to marketing@seba.org.eg, and we will be able to communicate with our speakers. But we have participant, Mr. Khalid Abdoun. He says, "Good afternoon, dear members. I'm offering services for patients from Egypt looking for treatment in Switzerland. I'm interested to know how important this aspect is at the moment. For your information, patients are welcome despite the COVID-19 crisis. Thank you for your feedback." So I think I'll throw this to you, Dr. Swilam, or Your Excellency, Dr. Ambassador Garnier. When are we going to see Egyptian patients flying back for treatment in Switzerland?
It really depends on what kind of management are we talking about. If it's a second opinion, remote management, I think it would be a good chance, good opportunity now. Because
sure.
Mr. If we're talking
with us online, if you want to clarify that question.
If we're talking about physical management and flying over, I don't think that's the best time to kick that off or to tap on it now, for obvious reasons.
Perfect. In all cases, I'm sure that we'll be able to get get you in touch and talk about that a little bit more, because of course, since we are SEBA, I try to be as Swiss as I possibly can on timing. But since we're in Egypt, I am exactly 11 minutes. Actually, I'm actually 6 minutes late. But Your Excellency, Ambassador Paul Garnier, do you have any comments that you want to make before we close our session, please? You're still muted, Your Excellency.
Okay. Voila, I think you can hear me.
Yes.
Okay, very good. So first I take the question of Mr. Abdoun and telling him for the time being, we have restrictions about non-Schengen citizens and generally speaking, so it's a bit difficult right now, but we are waiting like for the rest of the EU about news on the 15th of June. So we have to see. I mean, for real humanitarian cases, one or two, I don't know. You know, we would have to see. But yes, we have restrictions right now, as many other countries. And like Egypt as well, on the other side, by the way. Now, I also want to welcome the participation of Nagla Fati from Gafi, and I think it's very important that you are with us. And this gives me the occasion to say how much a webinar like this actually. We know why we are having a webinar, but actually it's a great added value, because we can include more people than in meetings that we would have, a coffee with SEBA and the Swiss Embassy to look at the problems of company. But I think we were really here opening a wider circle of participants, and this is very important. I want to thank once again the four great speakers that were addressing us today, and I want to repeat their names, of course. Mr. Mahmoud Bazan, Mr. Mohamed Abdelhakam, Mr. Mohamed Kassem, and Dr. Mohamed Swilam. And once again, I mean, to show my deep gratitude for today. I think what we have seen today as well is that how relevant and how diverse the Swiss presence, the Swiss economic presence is, and the SEBA members are. And this is once again showing to me that we gain a lot in discussing together and in uniting our forces together. And this is also what SEBA is all about. With now its new leadership, and I think SEBA deserves in these difficult times, because SEBA, as everybody else, has running costs and is confronted with the crisis, and that really deserve our very strong support in these moments. And I'm really believing in this new leadership for SEBA that will bring us one step higher. I want to leave it to Marwa Tahir to tell us about the next webinars that we are planning. And I mean, last but not least, I want to all wish you and your families to stay safe, to stay innovative, to stay committed, to stay compassionate as well. And I think we will all together manage this crisis and be in we will be probably in a different, but in a good place after this crisis. And thank you again for participating today. And thank you to the moderator. Over to you.
My pleasure, Your Excellency. It's always good to see you. Marwa, I'm not sure where she is. There you go. Marwa, you have the floor.
Yeah, thank you, Mr. Ambassador. Thank you, Ashraf. Thank you, all participants. Thank you to our speakers today. As I mentioned, we will keep the assessment of the impact of COVID-19 on different and several sectors and industries. Our next webinars will tackle also the measurements taken by both governments, the Swiss and the Egyptian government, regarding the impact of COVID-19. We will also focus on the CSR activities implemented from the private sector in Egypt. We will, of course, keep updating our members and our corporate partners and business partners about the upcoming webinars and the selected topics. So stay tuned, and I wish you all a nice Eid for those who are celebrating, and yeah, thank you very much again for your participation, and have a great day.
Thank you, Marwa, and thank you everyone, Your Excellency SEBA, for hosting us, all our wonderful speakers, and please stay tuned for our next webinar coming very soon, as Marwa said. Everybody,
and a big thank you to you, Ashraf, also for the host.
Thank you.
Thank you, Ashraf. Thank you. Bye.